Hi, this is Jody Roberts, student in the Doctorate of Athletic Training program at Indiana State University, reflecting cognitively on my approach to clinical practice as it relates to the domains of athletic training and how I have kind of improved or changed my methodology um, throughout the semester. So, first off, just reestablishing the 6 domains of athletic training. We have injury prevention and wellness. We have the exam, assessment, and diagnosis of injuries, immediate and emergency care, and then therapeutic intervention, as well as documentation and administrative roles as well. Before taking this class, excuse me, Before taking this class, as it pertains to injury prevention and wellness, I was not involved in injury prevention, performing any avenue, honestly, of prevention besides pre-participation exams. And my school does not currently host pre-participation exams. We are very far removed from working with clinics to do pre-participation exams. Um, and so that's kind of where I started at. Um, every sport is plagued with the same injuries that they have had for the past, 3 seasons. And I had a really hands-off approach to prevention, mostly because I didn't know how to research. I was overwhelmed with trying to know how to research and didn't feel like I had a really good starting place with that. This class taught me, though, a couple of different strategies with awesomely some things that I've been trying to work on, like ACLs and how to identify or screen for those people. It also even foundationally allowed me to review whether I was thinking about preventing injuries or am I just screening for injuries, and how I go about those processes and how they're different from each other. So now I have learned some techniques, I have gained some resources, but ultimately I learned mostly how to employ the people that I work with to help me. What technology, I was missing. I felt that there was no use in even researching what I needed because I didn't think that there was anything feasible that my facility, my district would be interested in pursuing the funds for. In reality, it didn't take a whole lot more of technology than I already had. It really just took research in how to utilize that technology. So even just using a camera or downloading a basic app or a cheap app to figure out different biomechanical issues has been something that I'm exploring and I'm excited to implement when the season comes around to do so. In the exam, assessment, and diagnosis portion beforehand, um, I would get to a place of not being sure what people were going through. And I'm sure that I'm still going to face moments like that where I'm going through an exam, I create a differential diagnosis, and I don't know how to eliminate it anymore. But what's different now is that I have a barrage of tests that I am either aware I'm aware of how valid they are, um, how specific they are to the injury, how sensitive they are to the injury that I'm looking for, and what combinations of tests I can use. Going back to even learning how to research those things and understand the research that I'm reading on those things has been a great help in improving my clinical practice. Beforehand, as it relates to immediate and emergency care, along with exam assessment and diagnosis, is that when I didn't know what the pathology was, or I couldn't find a definite answer on what was causing the issues that we were facing, I would refer because I'd be nervous that I would be sued if I let things get, too bad. And I think I was so consumed with my patients wanting to know what was wrong with them that I would jump straight to, well, let's hurry up and get you right in. Let's get an x-ray. Let's start this whole barrage of imaging tests that we need to in order to get where we need to go. Now I feel a little bit more confident in analyzing what tests to use and what those mean and what to do in the meantime while we figure it out. I'm a little more confident in waiting when I need to wait and know specific tests like the different Ottawa rules for decreasing the amount of people I'm referring for imaging. So that's been really helpful. This week I felt a lot on one of the last domains in athletic training, and that was therapeutic intervention. We talked a lot about return to play protocols. Beforehand, I felt like I had a pretty good grasp on return to play. You start with the basics, such as regain range of motion. That might include like decreasing pain, all of those things. And then slowly move through the phases of strength training, ending with like eccentric strength training, then move into functional, sport specific stuff. And then working with the coaches to decide if they were going to return to play. I was concerned, though, that knowing that I was just kind of piecing those things together on my own and never taking the time to research how valid they were or what other people were doing, or if there was a consensus on what exactly to do. After this week, I have discovered that that's exactly the case, that there are very few validated, if any, validated return to play protocols on different injuries. And what exactly to do. But the overarching theme that we discovered this week was that we need to listen to our patients, and we need to, I need to keep doing the things I was doing before, comparing to the strong side, slowly integrating them into sport specific things, and then assessing them not just from the sport specific side of things, how functional they are and all of those things, but also making sure that I'm getting back to the basics. What did their evaluation show us? Where were their deficits? How did that compare to their bad side? How did it feel when we first got them in? And tracking those things along. It really comes down to patient rated outcomes and how they're feeling, how confident they are on what they're doing, and then employing our sports medicine team to figure out how functional they are in their sport. So I found out some good things that I was doing, and then I feel more confident in what I'm doing because I had the slew of research articles show me that that's what we're doing. I'm repeating myself. One thing that I got stuck on, and there was one article specifically that said it, was we always get this question of when do I get back? And I in fact, like up to yesterday, even when I was finishing my reading, was so frustrated with, I felt like I was always guessing. I'd have a general idea of when it was, but what it came down to is, well, what have doctors told me in the past, or what have I seen in the past, and how that's basically been different for every single person that you treat, because they're always faced with different challenges, or they're approaching their rehab a different way, or they're returning to their sport faster. I found a little bit of forgiveness with myself with realizing that there are there's different criteria that influences your return to play decision, like what part of the season they're in. And does the athlete have pressure to return to play, or are they not giving you pressure to return to play? Are there external pressures, and are we going to listen to those things, and what's best for the patient, and getting back to the patient's goals and what they're centered on, what's best for them, comparing that against how functional they are, and if there's anything that we can do to make them more functional. Is there a brace or padding that we can offer that's going to help them be safe? So rereading that, I felt gave me better confidence in what I'm doing and the decisions that I have been making, and offering some forgiveness, and thinking that I felt before that I was sidestepping some rules, and like, this is how it should be. And now I realize, that's part of our job is balancing and weighing options and making patient goals and really working with the patient to provide integrative care and holistic care to ensure that the patient is seeing the bigger picture and to make sure that healthcare professionals are seeing the bigger picture, employing all the strategies that we can to make the person feel like a person. Are we working with their family? Are we working with their coaches? Are we discussing all the options? Are we making smart goals? Um, are we taking into consideration the patient's beliefs and values to ensure that all of their needs are being met and that we understand all of the deficits that they're facing? Um, I think that especially this last return to play protocol segment reminded me of that integrative approach. So I really appreciated that.